Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Beth Ingram was a teenager when she was locked in a mental health rehabilitation ward for several weeks. It made her feel desperate, and she says it was totally the wrong place for her. And according to a review of England's mental health services, too many mental health patients are held in locked wards far from home for an average of a year. The Care Quality Commission also says 40% of all mental health services need to improve patient safety. Our health editor Hugh Pym went to meet Beth and to hear her story.
The regulator's words are stark. Too many locked rehabilitation wards, many mental health patients feeling hopeless and powerless in a system which breeds isolation and institutionalisation. Beth can identify with that. In her late teens, she became mentally ill and had severe depression. For several weeks, she was detained for her own safety in a locked mental health ward. Now back at home and finding art therapeutic, she says the setting was totally wrong for her needs.
The ward was locked by several doors, and I very much did. I got to the point where I would bang my head on the door, I would run at the door when I was at my most desperate. I wasn't well, and you're desperate to get out.
The Care Quality Commission says it's concerned there are 3,500 beds in these locked wards, not including secure units for those who are a danger to the public.
We weren't expecting to find this many. We can't say exactly how many of the people in these wards don't need to be in a locked facility, but we do suspect that quite a high proportion of people in these services could and should be moved back to be much closer to home.
The report also says that across England's mental health services, 40% need safety improvements. Access to children's services is said to be a significant problem, and there are fewer mental health beds and nurses than in previous years. But the CQC says there are examples of excellent care and signs of improvement at some NHS trusts.
Whilst patients can feel safe and that they're receiving effective care, there are areas across the country where that's not the case, and we must turn our attention there and ensure that we bring everyone up to the level of good and safe and caring.
Things like crisis houses.
But Beth says health leaders need to look harder at where the system is failing.
You try being on some of these wards or having a daughter or a son on some of these wards. It's not the right place, and a lot of the time it would be unnecessary if there was just more care provided before people got to that point.
Beth wants to support others in a similar situation. She hopes the disturbing experience she endured is soon consigned to the past. Hugh Pym, BBC News.